All right, guys, so once that we go and have our King Vision blade established into the vallecula, is that we can go ahead and to see our beautiful vocal cords on the King Vision screen right here. If for some reason that we cannot go in to see, is that we could go ahead and to attempt a bimanual laryngoscopy, so just as so, but however, in this case, we do not need to do so. So then once that you have this established and we're there with that lifting upwards as so, is that we're going to go ahead and to take our ET tube, and you're going to want to make sure that your ET tube is there with that lubricated, because or else that this will be quite hard. And then once that you go through, is you are going to watch your ET tube go and pass directly through your vocal cords just enough, and then once that they are in and to in there at the appropriate depth, is we're going to go ahead and to pull the King Vision blade out just as so, holding on to that ET tube, and then we're going to go ahead and to continue with our confirmation techniques. Alrighty, guys, so the method for today is that we're going to be going over the King Vision laryngoscope system. So what we're going to want to do before that we go ahead and to skip right into our King Vision is that we're going to go ahead and to make sure that we have a good, solid BLS airway. And so then for this instance is that we are going to be using an oral airway, as well as with a ramping position. And so then with that, as that you can go in to see, is that we've got the corner of the victim's ear in line with our patient's sternum. So once that we have that, is that we're going to go ahead and to want to pre-oxygenate our patient. And so we're going to be doing this with a bag valve mask, as well as some nasal cannula at 15 liters per minute. As that you can also see is that we are also going to want our patient onto end-tidal CO2 to go into monitor their airway. And so then after that is that we're going to go ahead and want to get our second line, and then with that our third line, and then our rescue airways established. So then with that, our first line is going to be the King Vision and a endotracheal tube. The second line is going to be a laryngoscope and a laryngoscope blade, as well as the ET tube with a stylet in the hockey puck position. Our third line is going to be a bougie, and the bougie is going to be a mandatory third line airway device. And then with our rescue is going to be then with a King airway and or a surgical crate. And so then once that all this stuff is then with this successfully laid out, is that and the patient is done being pre-oxygenated, is then we're going to go ahead and to move on with our implementation of the King Vision device. So what we're going to do is go ahead and to turn it on there with a button on the back, and to use the screen. And so then once that our patient is successfully pre-oxygenated, we're going to go ahead and to ask our assistants here to go ahead and to end the stop, and then we'll go ahead and to move forward with our intubation. So what that we're going to do is to remove out the oral airway, open up the patient's airway, insert the King Vision in, look in as we go down, and as we go into the vallecula, lifting upwards ever so slightly, and we are going to be looking for that notch. And once that you can see that, is that we'll go ahead and go on to the second part of this video.